So I've entered the patient area, I've checked around to make sure that it's safe, which it is. I'm then going to sanitize my hands. So I'm just going to check the date on the hand sanitizer, which is fine. I'm going to sanitize my hands using the technique recommended by the World Health Organization.
So privacy, bib, name, hear and see, ID check, allergies, comfortable, and then I'm going to confirm the procedure to the patient.
Okay. So I've already introduced myself to the patient. I've checked that there's privacy, that the windows and doors are closed. I have already checked what the patient's preferred name is. I've done a 3-way ID check. I've checked the patient's allergies and made sure that they are comfortable, and then going to proceed to explain what it is I'm going to do and gain consent. So hi Sophie, I've just come to see if I can take a little bit of a blood sample from your finger just to check your blood glucose levels. Would that be all right?
Yes, that's fine.
Okay, so to do that, I just need to use a little needle that will prick the side of your finger and then just squeeze a little bit of blood out of there onto a machine. So are you happy for me to go ahead to do that?
Yeah, no problem.
Okay, so I'm just going to get my equipment, make sure that we've got everything that we need. So I'm going to assume that the tray's been washed in the last 24 hours with soap and water. I'm going to first of all open my clinical waste bag and pop that onto the trolley. I'm then going to get an alcohol wipe. And just clean the tray in a zigzag fashion. And pop that away. I'm then going to gather the equipment that I need. So I've got the strips for the glucometer. We've got the glucometer there. We've got some elastoplasts if we need them. We also need a lancet and some cotton wool. And we've got some wipes there and some gauze if we need them as well. We've got a sharp spin there. Just going to bring that a little bit closer. There. I'm then going to do my hand hygiene again before I put on the gloves and the apron.
I'll just remind you, so after you put on your gloves and apron, you are going to ask Sophie whether she's got a preferred finger, saying it's best not to do it on the thumb or the index finger. Confirm that the hands look clean, but I'll just give it a quick wipe to be safe. I'm going to use the single-use lancet. I'm just going to rotate the finger slightly to prick the side of the finger. You might just feel a short scratch, but you would have put the test strip in the glucometer
First.
you put your apron and gloves on.
Right. Okay. So I'm now going to put the apron on. And some non-sterile gloves. I'll just check the date on the strips just to be sure that they're in date, which they are. And then I'm going to pop one of these strips into the machine. The machine is calibrated, so I know that it is ready for you. Okay, Sophie, so what I need to do is just use this little needle to get some blood from your finger. Do you have a preferred finger that you would like to use? We wouldn't normally use the index finger or the thumb.
The middle finger's fine.
Okay, great. So I'm just going to give your hand a little wipe there. I can see that your hands are quite clean, but we just want to make sure that we get a good result and that it's not contaminated in any way. Just twist that to the right size. Then I'm just going to prick the side of your finger, sharp scratch. I'm just going to squeeze that very slightly so the blood goes onto the test strip. And that's it. And then just pop the cotton wool on there and just press that to stop any further bleeding. Just press on that just for a second or two. I do have some plasters available if we need them. Just have a look at that. That looks fine. I don't think you need a plaster on there. Examiner, could I just confirm what the test result is, please?
The test result is 7.
Okay, thank you. So the test result is 7. Normally the blood glucose result would be between 4 and 5.4 if you hadn't had anything to eat. But have you had any food at all today?
About an hour ago I had some toast.
Right, so that would explain why the result's a little bit higher than I would have expected. So at this point, if the blood sugar was low, I would be considering giving somebody some glucagon. If it was high, if they were diabetic, I would give them insulin if it was prescribed, and I would consider escalating it to the medical team. I will then remove my PPE. And dispose of that in the clinical waste bag. Gel my hands again. Then document the result in the patient's notes. So that's all done there, Sophie. Is there anything else I can get for you before I go? Are you comfortable?
Yeah, I'm fine, thank you.
Okay, the call buzzer is just there. If you do need anything, then just press that and we'll come back. All right. Thank you.